Well, we have a pain care crisis in the United States that's very well documented. We have a shortage of pain providers. We have a lot of different factors, primarily socioeconomic, and these factors are taking from the quality of pain care in the United States. While it's bad in the United States in general, in rural areas, because of the relatively low number of pain care professionals, the crisis is a dire one at this point. What we have is a lot of primary care physicians, although not quite enough, and they are the only ones who are able to really treat pain, they and mid-level providers, because there are no specialists in rural areas. The focus has to be on the roles of the primary care physicians and the mid-level providers if we're going to improve care in rural areas. All involved need to become more biopsychosocial and take on duties, take on responsibilities in pain care that are not traditionally considered part of medical care as we typically think of medical care. For example, nurses and physicians need to attend to the psychological needs of patients with chronic pain because there are no mental health providers with pain backgrounds in most rural settings. That would be one example. We also have to look at things like rural opioid crisis, which is more severe than the metropolitan opioid crisis. We have to look at underserved groups in general, including African Americans, Latinos, veterans, senior citizens, who definitely have higher pain care needs due to a number of factors, yet are receiving fewer services and oftentimes inadequate services. Well, I think this is a lot of speculation, but one reason is that we find that people in rural areas are more likely to self-medicate their emotional problems, and part of that is due to a lack of qualified mental health professionals. For example, half of the counties in the United States do not have either a psychiatrist, a psychologist, or a social worker practicing within the county. The other thing that should be taken into consideration is that risk mitigation has not come to rural areas as strongly as it's come to non-rural areas, so physicians are oftentimes a little bit less careful, we'll say, with opioid prescriptions. Again, as they don't have the other resources, oftentimes physical therapy, mental health, and the rest of a biopsychosocial component, they oftentimes feel like they have one hammer and one nail, and it's all about opioids. So prescription rates oftentimes are higher.